Hello everyone, this is Chadi Alraies coming to you from NCVH 2025. This year we have a new track. It's for structural heart intervention, which is a new venue. Been there, but not as robust as before. And Dr. Peter Phil going to talk to us about it. Peter, thanks for being with us.
Oh, thank you. Yeah, this is very exciting. This is the first year that has been a specific track specifically dedicated to structural heart.
Yeah.
We've had talks in the past, have been sort of smattered in between the peripheral vascular interventions and talks. This year we were able to consolidate that into one day of talking specifically about TAVRs, mitral valves, left atrial appendage exclusion, PFOs, et cetera. It's been very exciting.
Yeah, that's great. So are you presenting like trials or tools on what to do or updates?
A little bit of all of that. You know, since a lot of the participants in the room here are mostly general practitioners, I think a lot of us are just trying to get a flavor of what they're you know, when they see the patient in their office, what can they do to expedite moving forward for intervention, right, to a cardiologist, to a cardiac surgeon, et cetera.
To increasing awareness of the disease,
exactly.
And what option they have the patient for.
Exactly, and you know, there are a lot of times when we, as cardiologists or interventionists, will talk about certain procedures, and I think sometimes it gets lost on the general population or the general practitioner. You know, what are you guys doing? What, you know, why are you doing it? What are you doing it? Things like that. And I think we've been able to take that and sort of expound on here. This is what a TAVR is, and here are the patients that benefit. Here are the patients and are expected problems that we can see moving forward.
Absolutely, and I feel like in the United States there is pockets where there is a very congested cardiovascular and structural intervention done.
Yes.
Where there's nobody have no work to do,
right,
and yet there is area where anemic of these interventions. Yeah. So bringing this awareness, I think, has improved the visibility of these people.
Yeah, we actually had a very interesting talk by one of our speakers who basically is looking at those sort of populations that have not been ignored, but maybe underserved.
Yeah.
And how do we increase awareness not only to the general practitioner in that population, but to that general population specifically?
Itself. Absolutely, yeah. Well, Peter, this is a very important topic. I mean, again, not just to increase the business, but also more to the patient properly early when they are a candidate for some advanced
yeah.
therapies.
We unfortunately see a lot of these patients too late.
Absolutely.
And I think that's an important thing. And when can we get these patients early. Into even, you know, and I've always told my partners, I would rather see a patient that doesn't need anything now, but at least put them in the system so that as we move forward, I can look at them in 6 months, a year, 2 years, whatever the case may be, and make sure that they're being followed appropriately.
Absolutely. Peter, thank you so much for putting this together. And again, hopefully this program grow more beyond the day at NCVH.
Yeah, we're excited.
Yeah. Watch these videos and others on NCVH YouTube channel. This is Chadi Alraies coming to you from NCVH 2025 in New Orleans. Peter, thanks again.
Thank you so much.
Thank you.